We'll go ahead and get started. My name is Simran Strafani. I am the Health Policy and Advocacy Manager for American Muslim Health Professionals. Um, Today, we'll be conducting our Advocacy 101 training. We've done several of these in the past, and periodically we like to, provide it again for folks who are, getting newly acclimated to American Muslim Health Professionals, folks who need a refresh, and anyone else who might feel like, just getting to know a little bit about what American Muslim Health Professionals is doing. So today you'll be hearing from myself again. I'm the manager for health policy and advocacy program at American Muslim Health Professionals, and joining me as my co-presenter will be Sister Koser, and I'll let her introduce herself.
Yes, hello everyone. My name is Kausar Fatima. I'm currently the Health Policy and Advocacy intern here at AMP. I'm also a senior at the University of North Texas, where I am studying biology with minors in chemistry and Spanish. I'm also a clinical coordinator for a free clinic in Dallas County with my team, so we see a lot of uninsured patients and help connect them to resources in the area. I'm also an aspiring physician with interests in public health and advocacy, which is part of the reason why I got to know AMP, and I'm very excited to be here.
And we are so very happy to have you, and we're very fortunate to have you. I will also mention that we have another health policy and advocacy intern, Risa, who is on the line as well. And it was Sister Koser who lent me a lot of support in working on this presentation update. But Risa, did you want to, since Risa's providing a lot of support to other health policy and advocacy fronts, Risa, would you like to perhaps give yourself an introduction as well?
Sure.
No pressure.
Assalamualaikum, everyone. I'm Raisa. I'm the other health policy and advocacy intern with AMP. I've recently just graduated from the University of Texas at Austin, and I majored in public health. And so I'm spending my summer with my AMP internship and working on different policy-related things with some rows and putting together fact sheets, keeping up with a lot of the policy-related happenings on Capitol Hill and things like that. So I'm very excited to be here. Thank you.
Thank you very much. Appreciate you both. And so just wanted to note that, we've got two health policy and advocacy interns, and I'll tell you a little bit about American Muslim Health Professionals before I tell you about the rest of our health policy and advocacy program. So American Muslim Health Professionals is a national nonprofit organization focused on fostering collaboration between Muslim health professionals from diverse sectors of healthcare and public health who seek to advance public health, social justice, and other community engagement within their communities. AMP's mission is to bring together and strengthen the impact of Muslim health professionals to improve the health and wellness of all Americans. So that is to say that while the majority of our members are Muslim, whether they are healthcare practitioners, allied healthcare professionals, or otherwise community members with no, sort of career interest in health, we do serve all Americans. So, as any, physician, nurse, public health care administrator will attest to that, though they may have a passion in serving Muslims, they have a duty to non-Muslims as well. So, as public health professionals, we advocate on behalf of Muslims for all populations and all Americans. And occasionally those outside the United States as well. I'll tell you a little bit more about that shortly. Um, let's see, I'm trying to think if there was anything else about American Muslim health professionals that I wanted to mention. We'll go ahead and talk about the health policy and advocacy program next. AMP's members are a politically powerful, engaged, and informed network. They span generations, racial and ethnic backgrounds, very diverse occupations and geographic jurisdictions. As far as occupations, AMP's membership includes physicians, nurses, dietitians, therapists, public healthcare administrators, epidemiologists, social workers, teachers, folks who work across the mental health spectrum. I can't even begin to list all of the different titles there. Folks who work in private equity, folks who work in hospitals, folks who may serve on county boards or city boards of health or city councils. And we are distributed across the country. AMP is a national structure, but we have chapters in various states and jurisdictions and cities. Some are more active than others, so there's an opportunity for all of you to engage in that and become more engaged and active in your local chapters, as well as at the national level. The Health Policy and Advocacy Program, or the HPA program, focuses on advancing health equity and improving access to healthcare and other public health concerns affecting communities across America. And we'll talk a little bit about those policy priorities in just a few minutes. We inform federal and state policy through advocacy, education, strategic partnerships, while local chapters operate as close-knit networks across the United States, reflecting their communities and leading change across their respective regions through amplified voices of healthcare professionals. So what that means is we provide support to our local chapters. We work at the federal level and often at the state level to conduct our advocacy, to provide policy expertise, and on a few other areas, while our local chapters are sort of the front line or on the ground voices that represent American Muslim health professionals, whether that's in city council meetings or otherwise. I mentioned AMP's policy priorities earlier. So these are 6 that were developed last year based on an assessment of our membership as well as our leadership and community members. So we identified health equity and social determinants of health, access to care, generally regard that as access to healthcare, maternal, child, and family health, healthy nutrition and access to halal food, behavioral health, and youth mental health. Youth mental health was broken out separately due to the immense need of it. While there are many aspects of behavioral health that require our attention and are in need of being addressed, youth mental health as its own front has a number of its own distinct challenges and requires its own set of tailored interventions. And we're seeing the impact of the youth mental health crisis play out differently than we are across the adult population. So important to keep that in mind. Let's see here. So I want to make a distinction between advocacy and lobbying because it's fairly important. And what the crux of it is that advocacy is to educate and inform, and lobbying comes with a specific ask related to a piece of legislation. Now, with regard to advocacy, you can educate and inform on a specific piece of legislation, and you can educate on the burden that may fall upon a given community, or et cetera. But with lobbying, you are specifically asking a legislator to vote yes or no on a specific piece of legislation. And that's really the key distinction there. A better definition of advocacy, or broader, or an actual definition of advocacy, would be any activity that's aimed at influencing public policy, whether it's educating the public, raising awareness, building support for a cause. It can be directed at a wide range of audiences, including the public, policymakers, and other stakeholders. This can be done through, as I mentioned, raising awareness. It could be through social media. It can be, educating policymakers about the impact of a proposed law or rule. We'll talk a little bit more about the specifics of legislation in just a moment, but bills or legislation that go through Congress or state legislatures are not the only policy that a given group or individual may want to advocate on, and I'll talk a little bit more about that later. It can, again, just going back to the examples, it can include organizing public demonstration to support a cause. It can also include providing research and data to support a policy position. I think if there's anything else I want to cover there, I'll talk a little bit about why it's important for us to engage in advocacy. And it's really because your voice matters. Less than 60% of eligible voters ever register to vote. Less than 50% of eligible voters vote in most elections. Less than 30% of a candidate's supporters stay involved in developing legislation after elections. And stories affect different parts of the brain than fact-based arguments. They trigger feelings and emotions which guide our actions, right? For those of you who may be familiar with the stages of change, it's important to remember that the folks who are our decision makers are at the end of the day human, and we'll talk a little bit more about specific strategies for different groups. Some basic principles of government. Let's see, we've got the 3 branches of government. We have the legislative branch, which is Congress, the executive branch, which is the president, administration, and the judicial branch, which includes the Supreme Court and other federal courts. Advocacy works primarily in the legislative branch, which is, again, Congress. You've got the House and you've got the Senate, but it can certainly involve the other branches as well. Most folks, if they were to engage with another branch in advocacy, it would be with the executive branch. It could be, perhaps a representative. There are many offices and representatives of the executive branch that one might advocate to. It doesn't have to be, to the president, the vice president, or the cabinet directly. Um, it can be, through a statement as just, another example. While, with the judicial branch, there are certainly folks who conduct advocacy. It can be in the form of certain memos, to paraphrase, that can be provided to the Supreme Court and other courts. Some, fairly basic breakdown of the Congress. You've got the House with 435 members, the Senate with 100, and I apologize for some of the background noise here. Move through this. This is, the breakdown of how a bill is passed. It's introduced by a member of either House or the Senate. Committee meets to discuss and then vote on the bill. The bill proceeds to the full Senate or the House, where it's debated, amended, brought to a vote. Then the bill has to pass both chambers of Congress. So often a committee made up of both chambers reconciles the differences. We saw this just happen with the budget reconciliation bill fairly recently. And then both chambers vote on the bill, goes to the president, and it is signed into law generally. It can be vetoed, of course, per the diagram you see in front of you. Here's a great resource for some advocacy. Congress.gov has details on any legislation that's passed or current. And as we mentioned earlier, advocacy can be for a cause in general or a specific piece of legislature. So that's to say, you may advocate for folks who are experiencing homelessness, or you can advocate for or on a piece of legislation that might address that issue. I'll pass it over to Sister Coulter now, and yeah, take it away, Sister Coulter. Thank you.
Yeah, thank you so much. So the segment that I'm going to start off in is just kind of finding your niche in advocacy. So maybe you don't know where to start, or you're just kind of exploring the area and figuring out what causes you're passionate about. So this is just kind of introductory for that. Next slide, please. So on this slide, we just have a couple infographics from ISPU. And so, as we kind of talked about, our organization focuses on representing the concerns of all Americans, but we do have some focus on the Muslim community. And here on these studies, we can see that these are the top priorities for Muslims in the past couple of years, and how they're most passionate about healthcare, economy, and social justice, and how they are more likely to care about healthcare and access to healthcare. And so that's kind of where we tend to focus on, and why we dedicate effort towards these causes. Next slide, please. So now we kind of have an exercise that we can do for brainstorm. So to kind of find your niche in advocacy, this is kind of the who and the what. So Sunrose talked a little bit about how stories tap into a different part of our brain, and kind of when we're talking with people and stakeholders who have a say in these issues that we care about, this is where we can really make a difference. So everyone has a story, and you bring a unique background, your upbringing, your job, your circumstances, your culture, all the people that made you who you are, the people who you want to be, and the people who you want to influence. So you can kind of just take a minute to sit down, think, who are you, what do you care about, and identify places of your life and stories that you can speak to. What stories, facts, and lived experiences do you bring to the table when you're advocating for the causes and people that you care about? So just a little example we have here, like clinicians such as physicians or nurses may have a particular patient or a family member that they have in mind, and these are the stories that they can bring into the table and kind of weave into their appeals. So we also have a little infographic showing the social determinants of health if you need some help getting started. So in these causes, is there something that comes to mind? So maybe you could sit down for a couple minutes when you're trying to think about the types of people that you want to represent, the causes that you care about. So next slide, please.
Mr. Coulter, I'm just going to jump in real quick. With a quick comment, for those who may not be familiar with the social determinants of health, they are factors or categories of factors that are known to affect our health without being specifically, health related. So economic stability, employment, income, as one example, are known to strongly impact our health. So that's what the social determinants of health are. And if you have any questions about that or would like to learn more, please feel free to reach out.
Yeah, absolutely. So now we kind of get into some more specifics on building your niche. So this is kind of how we transform the past slide. So your brainstorm, the what, the who and the what into why and into action. So here we see how you can focus on specific issues within those causes to make your efforts more effective. So in the bold, we have here who or what are you advocating for? And then let's get a little bit more specific. What is the ideal impact or purpose that you want to have? And who are the stakeholders? So just as a kind of definition, stakeholders are people with a say in the conversation or issue that's being discussed. This can be as broad as the people that you are representing or a specific government member or legislator who you want to appeal to or speak to. So kind of go back to that list of strengths and interests that we did in that exercise or that you can do on your own time. Which stakeholders do you want to work with or who you feel that you can connect with best? You can kind of find this online. There's a list of government officials who maybe you can speak with, or it can be a little bit more informal, and you find people in your community who you want to speak with on this issue. So on this infographic here, we have some examples of stakeholders and groups and players. So as we said, that can be patients and citizens. It can be third sector, such as charity and associations, kind of like AMPM in and of itself. You're getting involved right here. And so that's an example of getting your foot in the door and kind of getting involved with stakeholders and figuring out where your place is and building your niche. Next slide, please. So developing an elevator pitch is kind of our next step here. So this is important because when you're introducing yourself to those stakeholders that we discussed in the last slide, we want to make sure that you have a good in and a way to introduce yourself and connect with these people. So you may already have one for getting the position that you're in right now, but now that we're kind of introducing those advocacy themes that we talked about earlier, now is a good time to sit down and revise this perhaps. So who are you? What is the important issue that you care so much about? Why is it important to you and to the people that you are advocating for? And what should the audience do? So considering your purpose, like when we talked about the difference between advocacy and lobbying, that's kind of an example of how you can get specific. So adding an ask or not an ask, but adding a call to action at the end can kind of help move the conversation forward. And it's another way to connect with the people you are speaking with. Next slide, please. So now we're going to go ahead and talk about the advocacy archetypes. These are very general. It's not the end all be all, very comprehensive, but it's just somewhere to start. Next slide, please. Before we get into that, though, there is something we want to talk about regarding the advocacy strategy framework. So this little infographic from evaluationinnovation.org is just a very general and comprehensive outline for how the different types of advocacy can kind of fall on the axes of audiences as well as outcomes. So the type of advocacy that we do at AMP and the type of advocacy that different people are capable of can fall anywhere on the scale. Some of it might veer into lobbying, but this is pretty comprehensive. So, you can pick how involved you want to be and who you want to work with. So on the bottom here, for audiences, we have public, influencers, or decision makers. So you can choose how involved you want to get and who you want to work with, and the type of impact that you want to have when we talk about outcomes up at the top. So the type of advocacy archetypes that we talk about, we're going to kind of see where it would fall on this spectrum. Next slide, please. So there are many ways to be an advocate, but the ones that AMP engages in particular and provides opportunities for include these following 5. 1 being engagement with Congress, 2 is community coordination, 3 is digital organization, 4 is connecting with coalitions, and 5 is research and publications. Next slide, please. So before we delve into each of these five archetypes, something that we wanted to touch on is the idea of an evidence-based approach to advocacy. So with advocacy, there's so many ways you can get involved, but now AMP has identified a need for evidence-based advocacy. And so what this means is making sure that you have things to back up what you're saying and facts that you can point to when things are tough, when things are difficult. And so all of the five archetypes that we outlined in the previous slide can connect to this overarching theme, but obviously there is emphasis on research and publication because it's giving you that evidence that we were talking about. And it's more important than ever right now. So a 2023 discussion paper discussed a new policy and advocacy model that integrates this evidence-based framework that we were talking about into their framework. And so this model emphasizes focus on gathering data and research like we discussed earlier, but also the idea of policy bottleneck to identify and address barriers to specific issues highlighted. So when we think about this from the perspective of legislators, there's so many different issues that they have to consider. And so it's kind of hard to stand out when it comes to that. So one way that we can kind of work with that is kind of leading into the evidence-based model and making sure that we have data and understanding that we have something, a foundation to stand on when we're engaging in advocacy. So this is just an example infographic that we found from that discussion paper. If you're interested, we have that linked in the slides as well. But it's important to kind of have that to contextualize where we are in the broader theme of advocacy and how it can play out in day-to-day life. Next slide, please. So I think that's the end of what I'm going to focus on. I'm going to pass it back over to Samrose. Thank you so much.
Thank you so much, Mr. Costa. Really appreciate you. I'm going to hop back to this last slide here. And I just want to shout out, my predecessor, Sheila Jawani, who put together a lot of the information that we used for this training. And then Sister Costa was wonderful enough to conduct a lot of research and bring some of the evidence-based framework to our advocacy work. There has been, so much advocacy that's been occurring since October 7th is in particular, I think set off a wave of advocacy across the country in our community. However, the American Muslim community has been engaged in advocacy for quite some time. But with, I think, such a large influx of new folks coming in, we felt that it was important to bring in sort of the evidence-based strategies, the framework for advocacy that has been proven to make an impact. So that's kind of why we brought in a little bit more of the framework here. So now we'll get back to engaging with Congress and sort of the what does it look like to engage with Congress. So just some pointers to start with. You find a member of Congress, find their information on the House or the Senate website. In a nutshell, you can engage with them in the long term by offering to provide support on certain issues. If you have subject matter expertise, some of them will very gladly take you up on that. And it may be that you have to reach out to them to remind them that, hey, I know you're working on this, or I know this issue's been, percolating for a while. So what can I do? Is there anything I can do? Or it can be, can we have a quick meeting to discuss XYZ? Building a network with congressional staff. This cannot be overstated. The importance of this cannot be overstated because you will likely never hear directly from a member of Congress. You will rely on their staff to get them information as well as receive information from their office. So building your network with congressional staff and with specific staff will go a long way because they can get you connected to the right folks. In other member offices, they can be incredibly influential in setting things up for you, and they do talk to each other, so important to remember that as well. So meeting with them, important to conduct your pre-work. Of course, email them to schedule a time If you happen to be in the Capitol, it's always okay to swing by an office and check to see if folks are in the office. But if you're setting up a meeting, you want to contact their office, reach out to their schedule, or if you have their policy staffs, it could be their legislative director. For many of us, it may be their foreign policy staff person. Uh, and then, of course, research the member, know their voting history. You don't want to walk into a member's office and say, hey, you need to be doing this. And they look at you and say, did you look at the last 3 bills I proposed? Because that can get awkward pretty quickly. And then remember that you may be meeting with their staff. So if you don't see them, if you don't see the member themselves, that's okay. Their staff are no less important. Oftentimes, members will not remember the details, but their staff folks will. So make sure that you're respectful and that you treat them with the utmost respect. And be flexible with timing as well. They may tell you have 15 minutes, you may have 5. They may tell you have 15 minutes and they may end up, making it clear that they want to dive deeper into the issue. During the meeting, jumping ahead of myself a little bit, make sure you introduce yourself, context of the issues. In those first couple minutes, find the common ground, break the ice, and build that relationship. It can be to the member directly, it can be with their staff. It's perfectly fine to socialize with their staff. It's perfectly fine to ask questions to understand the staff's area of expertise to see, have you worked on this issue prior, or how long have you been with the office? It's perfectly okay to ask those questions. Towards the end of the meeting, when you're done informing them and educating them and conducting your advocacy, even if it's relevant during the conversation, you can also ask for appropriate ways to support the congressperson and create a mutually beneficial dynamic. It may be that you can support some FaceTime with constituents, right? That's just one example. After the meeting, send them an email saying thank you, and make sure you follow up on any information that they requested or that you promised that you would follow up with, because they will likely remember that when they need that information later on. And then, of course, ensure that you're providing your contact information as well as the information of the group that you are representing, if there is one. If there's anything else here I want to mention. And then always important to keep resources with you. If you have fact sheets, resources, infographics, bring those to the meeting as well. And always remember to tailor your argument, your proposal to your audience. You can be educating on the same piece of legislation very differently back to back in meetings with members. Some folks may care, and I'm generalizing here, but some members may care exclusively about the fiscal impact, while others may be less so focused on that and more so focused on the social or the human impact. We'll dive a little bit more into the functions that you can engage in with regards to advocacy. Sister Kosa touched on some of these earlier. Community coordination allows advocates to add a more personal touch and work directly with community members. This can be done by surveying community members, engaging with them, not just through a digital survey, but through informational sessions, town halls. You can work to identify stakeholders. Oftentimes the folks who are great champions or key decision makers may not be engaged in the conversations with community members. So incredibly important to bring those folks in. And sometimes it just takes a new set of eyes and a fresh mind to think about some stakeholders who aren't already at the table or who haven't been engaged in, developing solutions or assessing what the issue might be to start with. Mobilization, of course, this is something where you customize your approach to the advocacy topic and the resources that you have, and always, ask yourself what method is best, in context of the infographic that Sister Kosa shared earlier. Digital organization allows advocates to build and maintain momentum and engagement. It can be a vehicle to larger events or the event itself. It's very versatile and connects, uniquely with other archetypes for greater collaboration. Examples might include email outreach, a virtual town hall, social media, or social media storm. Working with media partners to to engage and leverage community sentiment. Connecting with coalitions, this is something that AMP does fairly well. We have a number of partners across the American Muslim nonprofit space. It could be Islamic Relief, the Islamic Food and Nutritional Council of America, CARE, a number of others. Uh, there are coalitions that don't primarily or exclusively serve the American Muslim public, like the Alliance to End Hunger. We're an active partner in that as well. And so those coalitions are often formed to serve a particular purpose. Joining or starting a coalition centered around either specific specific legislation, or a general cause can gather individuals with different skill sets to accomplish various objectives. And AMP, can be considered a coalition. And so we're very happy to connect you to the folks internal to AMP or at other partner agencies to make sure that you find the coalition or the partners that can help you achieve your outcome. Research and publication, this was touched on earlier, but one of the greatest examples of this is one of our partners, ISPU, that's the Institute for Social Policy and Understanding. They conduct a lot of research related to the American Muslim population. Some of their infographics were referenced earlier. Research and publication, generally encompasses the generation of material that shapes legislature and is the content used in advocacy. It can include anything from data analysis to publications like an op-ed. There's a number of audiences that you can reach, and there's some more information about that strategy here. So now let's talk about where those archetypes fall in the context of the graph where we talked about the outcomes of the audiences. Different skill sets and different functions will fall in different places. And as Sister Kosa mentioned earlier, when thinking about the cause that you are advocating for and the outcome that you are looking to achieve, it's really helpful to look at this and understand where your impact can be most valued. So that's a lot of information. Advocacy is a very broad world. We mentioned a number of public health issues. There's a number that we didn't mention. We are meeting with a number of Muslim serving organizations later in the year to put our heads together to, sort of determine the high priority policy needs across Muslim America. And so that's to give you an idea that, even as Muslim organizations who are in the realm, there's a lot to work on. Just in public health and healthcare, there's an immense amount of work to do. There's an immense amount of advocacy that stands to be done. And there's a lot of issues that require our attention. And so if you're still not sure where to start, we have an advocacy guide. You can start by signing on to the letters that we send out. You can send emails to your members of Congress and your stakeholders. You can join community events that either AMP convenes or other community organizations like CARE or others convene. You can provide testimony at your local city, your local city council, your state council, your county board, boards of health, city councils. They're always very happy to hear from residents who are passionate. And if you have expertise to accompany that, that is even more valued. You can attend trainings and like this one and find folks and find resources and find strategies to help you achieve any objectives that you may have related to advocacy. And you can also just contact us and say, hey, I want to get more involved in the health policy and advocacy space, and we can direct you accordingly based on your interests. And then last but not least, it's really important to take care of yourself. Advocacy can be very emotionally taxing. I'm sure many of us feel this after the last couple of years. It can be an incredible burden, and it's very difficult to pour from an empty cup. So here's some strategies to help you. It includes finding community, checking in with yourself, making sure you're stopping to feel your emotions, maintain distance when you need to, and enforce those boundaries. Seek counseling and therapy when it's appropriate. And again, you can't pour from an empty cup. So I just wanted to make sure we leave some time for questions. Thank you to Sister Koser and the rest of the American Muslim Health Professionals team. Wanted to shout out another sort of body of AMP, which is the Health Policy and Advocacy Committee, or HPAC. We got it restarted several months ago, and we've got a great membership from across the United States, folks who have all kinds of different roles. And so we're, working on a number of things, whether that's statements, engaging with different stakeholders. Again, we just got started up again a few months ago. But from my perspective, it's great to have a whole bunch of eyes and a whole bunch of minds to look at what's happening in the public health world, to offer their input to position statements and fact sheets and whatever else we're working on at the time. And so that's a little bit about the HPAC. And so please stay in touch with the program. I'll leave some time for some questions here if you all have any. But again, thank you so much. And yeah, we'd love to take any questions if y'all have any. All right, going once, going twice. All right, we can go ahead and close up early. Inshallah, we'll be holding a second part to this advocacy training soon. We've done a few 101s now, so we'll be doing a 201 where we'll dive into a little bit more nitty-gritty about how you can craft, whether it's a position statement or an op-ed, and how you can reach out to the right folks to do that. So stay tuned for some of that information, and appreciate you all being on the call with us today, and very much looking forward to engaging with you all, whether it's whatever format that may be in. Take care. Assalamu alaikum. Thank you.